You do not get free healthcare. You do not get free healthcare.
Yo, what is going on, everybody? So today we're diving into something that gets people heated on both sides of the Atlantic. We're talking about healthcare in Europe versus the US, and apparently some MAGA voters are having a full-blown meltdown, finding out that people in other countries can just go to the doctor without selling a kidney. First, we got people living abroad having their minds blown. We got folks breaking down the actual math on taxes versus insurance premiums. And we got some wild stories that'll make you question everything you thought you knew about how healthcare systems work. This one's going to be a ride, so welcome back to Mind Mirror. Let's get into it.
Let me shock some Americans, because it seems like some of you think entire world works just like in the US. 1. Did you know that in most parts in Europe, university is free? Yeah, you don't pay anything. So, unless you had like bad grades in high school, then you have to go to the private one that does cost around $300 per month. 2. When you go to the hospital, you pay nothing, around $0, because it's free. You don't have to end up deep in debt.
She's listing these things off so casually, like free university, free healthcare one time, car registration, and you can tell she knows how wild this sounds to an American audience. But here's the thing that really hits different about this. None of what she's describing is some radical experiment these systems have been running for decades. Entire generations of Europeans have grown up never knowing what medical debt even feels like. Meanwhile, in America, we've normalized the idea that getting sick could bankrupt you. We've accepted GoFundMe as a healthcare plan, and that's just insane when you say it out loud. The fact that this woman can list basic government services, and it sounds like science fiction to Americans, should make everyone uncomfortable.
Yeah, I know that is shocking, but that is how it works. And 3, did you know that when you register your car in Europe, you do it once when you buy a car, and then second time when you buy another car? You don't have to do it every year. What for?
So I've been having a sore throat for now 3 days. I really think it's strep throat. So I'm going to the doctor and I will take you with me. So I live in Denmark, and like most places in Europe, going to the doctor is free. All I had to do was to call, and I got an appointment for today because everyone has their own doctor. So we'll go, they will do a swab, and we'll see if I have strep throat or not. And then if I do, I will get a prescription, and then I'll go to the pharmacy and get some penicillin. I will have to pay for the penicillin though, but everything else is free because healthcare here is free. So I just came out of the doctor, took about 10 minutes total, 8 minutes waiting and 2 minutes to get the swab and get the results. And it turns out that I do have strep throat. So now I'm waiting for my prescription to be ready. I will get a notification in this app from the pharmacy that I have. And once my prescription is ready, I will go to the pharmacy and I will get some penicillin and I will start my healing process. And as I mentioned earlier, all of this was free except for the penicillin that I will pay.
10 minutes. The entire visit took 10 minutes, 8 minutes. Waiting 2 minutes with the doctor, and she's walking out with a diagnosis and a prescription. No paperwork, no insurance verification, no calling ahead to make sure her plan covers strep tests. And I know someone's going to comment, oh, but that's just a sore throat. Try getting surgery. Fair point. But think about how many Americans avoid the doctor for small things because of cost. That sore throat turns into something worse because you waited 3 weeks hoping it would go away. That is where the real damage happens, not in the big surgeries, but in the everyday care people skip.
Because I live in Denmark, and in Denmark, healthcare is free.
8-month-old Indy Gregory fought for her life against the UK government. Because of her mitochondrial disease, a terminal illness, she was put on life support and the British government wanted to pull the plug. Now, the UK has free universal healthcare, so if the government doesn't feel that it's the best allocation of resources to keep Indy on life support, since it's paying for her care, it has the right to terminate treatment against the parent's will. Since the UK government insisted on pulling the plug, Indy's parents said, hey, we at least want to take our daughter home so she can pass surrounded by her family. But the British government said no. She had to die in their hospice. So hearing about the tragedy, Italy gave Indy Italian citizenship. The Vatican granted her admission to the Bambino Gesù Hospital, cost covered, where the doctor said she may have been misdiagnosed, or at the very least, people with her disease have lived into their 20s and longer, and the parents wanted to take her, but the British government said no. So the parents took it to court, and the parents lost. So the British government was holding an Italian citizen hostage so that it could die in a British public hospice against the will of the parents, the Italian government, and the Pope. How did the government have the right to do that? A government-funded hospital doesn't have to care for a terminally ill patient's treatment, but it can hold the patient hostage now, bar it from other treatment so that it dies under British care now too? Maybe you agree with the British government that it's the right thing to do to pull the plug, but it doesn't matter. The government's wishes for your child should not override yours, but in a universal healthcare system, the government gets to choose who gets care and what kind. It's very easy to fly a British citizen to Switzerland or Canada to be euthanized.
Now, this story about baby Indy is genuinely tragic, and I'm not going to make light of it, but I need to point out the logic gap here because she's framing this as proof that universal healthcare gives government too much power. And emotionally, yeah, that hits hard. No parent should lose control over their child's care. But what she conveniently ignores is that in America, insurance companies make these exact same decisions every single day. They deny experimental treatments, they override doctors, they let people die to protect profit margins. The difference is when a government does it, there's public outrage and court cases and international attention. When a corporation does it, you get a denial letter in the mail and a customer service number that puts you on hold for 45 minutes. So the question isn't whether someone else will make decisions about your healthcare, because they will. The question is, do you want that someone to be accountable to voters or accountable to shareholders?
But not to Italy to be saved. And this isn't the first time Italy's offered. When you lose your ability to pay for your healthcare, you lose your right to choose what happens to you. And when medicine is socialized, ethics are completely out the window. You are reduced to a number in a long line of other numbers waiting for treatment that costs the government money, and they don't want to lose money. So guess what they're inclined to do to you? Where there is private medicine, health professionals have every incentive to be more ethical, because if you don't like how they treat you, you can go somewhere else and they lose money instead of save money, which is the opposite of what would happen in socialized medicine. The UK pulled the plug on Indy's life support, and after hours of fighting, she has passed.
When Paula gave birth to her baby, things didn't go as planned. Her newborn had to be rushed straight to the neonatal intensive care unit, the NICU. For weeks, doctors and nurses worked around the clock, using advanced machines and constant care to keep the little one alive. And then came the shocking part: the hospital bill. The total cost for the NICU stay reached an unbelievable $1.5 million. Thankfully, Paola had health insurance, which covered most of the expenses. But just seeing that number printed on paper was enough to terrify any parent.
$1.5 million for a baby. Let me say that again because I need it to really sink in. $1.5 million. Insurance covered most of it, sure. But what about the family where insurance doesn't cover most of it? What about the 27 million Americans who have no insurance at all? Their baby needs the same in ICU. Their baby deserves the same care. But instead of focusing on recovery, they're drowning in debt before the kid's first birthday. And we just accept this as normal. We shouldn't.
Her story quickly went viral, leaving families around the world stunned. It highlighted one of the biggest differences between the U.S. and many other countries. While in Europe a birth is usually fully covered by public health care, in the United States, parents can face life-changing bills. Today, Paola calls her child her million-dollar baby. But her case raises an important question. Should any parent ever have to face a bill this huge simply for bringing a life into the world?
I basically just want universal health care.
No, the VA. So don't interrupt him, please. Like, you want more health care like the VA. It doesn't work. There are waiting lines. The quality of care is very low. The complaints are through the roof. Bernie Sanders wants our entire healthcare system look like the VA. Defend it.
I'm just saying that I'm not asking for, like, I know UK and Canada have super long lines in their healthcare system, universal.
No, it's not even abstract. I'm talking about the VA is a real American example. It's not about the Canada. It's not the UK.
I think it should be reformed.
No, forget the reform. The VA has hundreds of billions of dollars of funding. It's taxpayer funded. The veteran pays nothing. They go there and it's all paid for. That's what Bernie Sanders wants, and it's largely a catastrophe. So show me and tell the American people why we should do more of that.
I think we should have a new system, though.
Okay, but it's not a new system. Bernie Sanders wants the VA for everybody. So I want you to know what you're advocating for when you say that you want Bernie Sanders health care. You want the VA. Okay? Here's what we want. We want, of course, more competition, price vouchers, want the hospital lobby put on defense. But honestly, we want to be able for you guys to choose the doctor of your choosing, to be able to say, you know what? I don't want to have to take 6 vaccines when I walk into this doctor. I want medical freedom. Where in the VA or in a government-run hospital, you must take those vaccines. There are no exceptions.
I do believe in some type of privatized healthcare, but I think
then you don't believe what Bernie believes.
The government should support that.
Well, hold on.
So more affordable people can afford that.
By the government, you mean the taxpayer. So then, therefore, you mean higher taxes for working people. Because every time socialism is tried, every time it is taxes on more working people. He might say it's more taxes on billionaires. He might say it's more tax on the rich. It's everyday carpenters, welders, police officers, and people that work their hands that end up paying more in taxes.
I'm starting to be a CNC manufacturer.
Great. So. And Bernie Sanders will raise your taxes. That's the fact. And you know what Donald Trump is fighting for right now? And Bernie Sanders doesn't have the courage to vote for it? No tax on tips. No tax on overtime.
Here's what frustrates me about this whole exchange. The guy asking for universal health care keeps getting shouted down with the same tired talking points. Oh, it's the VA. Oh, it's socialism. Oh, your taxes will go up. But nobody on that stage actually addresses the core problem, which is that Americans pay more for worse outcomes. Like, you can yell about the VA all day, but the VA's problems come from chronic underfunding and mismanagement, not from the concept of government-provided care itself. Every other wealthy nation figured this out, and their people live longer and pay less. At some point, you got to ask yourself, are you arguing against universal health care because of logic or because someone told you to?
If you are an American and you don't want universal health care, I've only ever heard 2 reasons why. And that is, 1, it's socialism, which if that's what you think, then you are too uneducated and too unintelligent to save. Number 2 is because people complain that countries that have universal health care have a higher tax rate than the United States, which if you look at it on paper, you're right. But if you just do the math, you're incredibly wrong. And so I'm just going to do the math for you so you don't have to. The average Denmark citizen makes about $55,000 a year, and they pay about $20,000 a year in taxes, which if you do the math, a 36% tax rate. But you have to remember that that taxes is paying for a universal healthcare system. So Danish people do not have health insurance premiums that they have to pay. Now, if you look at America, the average income for an American citizen is $61,000, and the amount of taxes that they pay is $17,000. And the average American citizen is also paying $8,000 to $9,000 in health insurance premiums annually. Now, if you combine the taxes annually and the health insurance premiums annually, you get a rate of 42%, which, if you remember, not too long ago, the Danish people are paying 36% tax rate, and Americans with their tax rate plus their insurance premiums is 42%.
36 versus 42. That's it. That's the whole argument right there. And he just ended the debate with basic arithmetic. Danish people pay 36% and get healthcare, education, and peace of mind. Included, Americans pay 42% when you add taxes and insurance, and still got to worry about copays, deductibles, and surprise bills. On top of that, and nobody ever breaks it down, this simply because the people who benefit from the current system don't want you doing this math. They want you scared of the word socialism, so you never pick up a calculator, because the second you do the math, their entire argument falls apart like wet cardboard.
So again, tell me how Europeans are paying more in taxes when they don't have to spend money on health insurance premiums. I'm waiting.
These are the reasons why Denmark is better than America. Healthcare. If you're sick, you go to the doctor. No huge medical bills to follow because you already paid it in your taxes. Education, college, master's degree, free. Oh, and also they give you a living stipend while you're in school. Can you imagine what it would be like to go to college and not get in crippling debt? The infrastructure. They bike everywhere. It's amazing. You can bike, you can walk. Do you know how long it would take me to bike somewhere in Texas? Like 5,000 years. Obviously, design. Everything is so much more beautiful here. Thoughtful. I know I live in Texas, which is extra ugly because it's just like concrete, but here it's just like, this year while everyone had COVID, they just like paid you your salary and you stayed home. Anyway, just a couple of things that make me really question my citizenship.
Things that would send Americans into a coma, part 4, medical edition. Hi, my name's Rachel. I hurt my thumb. I don't even know fucking how I did it. But anyways, I did this on Friday. Today is Tuesday. It's just been getting worse and worse and it really hurts. And so my husband was like, call the GP. The GP is what's a general practitioner. It's like your doctor. You have like a specific one and they're like right in your area. So I call them at 8 a.m. when they open and they're like, okay, you're in the queue, hit 1 and we'll call you back. They call me back within like 10 minutes and they're like, what's the problem? I don't even think they said anything. I just started talking. And then they're like, can you come at 11? I was like, bet, I'll be there. I get there at 11. They call me in at like 11:03. He looks at it for like 2.5 seconds with gloves on. He's like, you need this and you need this. Electronically sends it to the pharmacy right near me. I go straight there, walk my little ass there, put my information in, sit down. 5 minutes later, Rachel, yep, that's me. This would never happen. You let me know what your experience is like in the U.S. But in the U.S., if this were to happen to me, I would have to go to like an urgent care. And in the urgent care, they would just then be like filling in forms, waiting around, everyone everywhere, just in the same room, just like being sick all over me. Not having like one place that has all my medical information, spending probably over $100 just to like be seen, and then having to pay for prescriptions. These prescriptions were like 19 pounds, which is probably like $25. But seeing the doctor was free, same day.
What really stands out to me is how she describes the U.S. experience versus what she just went through. In America, it's forms and waiting rooms and sick people coughing on you and fragmented medical records and surprise bills. In the UK, she called, got seen same day, paid 19 pounds for her prescription, and went home. And she makes this really important point that if you grew up on the NHS, you might not even appreciate what you have because you've never experienced the alternative. That's real talk right there. Sometimes you don't know how good you've got it until you see how bad it can be. Every American should spend 1 week navigating European healthcare just to see what's possible.
Say whatever you want about the NHS, and if you've grown up on the NHS, maybe you just don't have the other experience of having to pay ridiculous amounts for just basic services, but I love it.
So, your total for the sprained finger is $700,000.
Again, please?
$700,000. Oh, sorry, you also had a small bottle of water. That's an additional $9 million.
Oh, your bill for the 16-month stay in the ICU, your heart and brain transplant, your eyeball transplant, spinal realignment surgery, 11 years of physiotherapy, full membership for the wellness center, psychiatric therapy sessions, coronary revascularization, surgical ventricular restoration, spinal osteomyelitis surgery,
Don't remember that one.
thoracic aorta dissection repair, aortic endarterectomy, and a small box of tissues for the sniffles. In total comes to -€3. Moment.
Come again.
1, 2, 3.
Okay.
To see.
Now listen, it's worrying times. You might lose your health care, you might struggle to put food on the table, but poor MAGA Mike needs a wee nap.
Speaking of which, let's just check in to see how the negotiations are going.
People keep commenting to me, you look so tired on TV. I am so tired because we're not sleeping a lot. We're working overtime.
I'm glad that you saw my tweet. It lasted 3 million nasty people on the internet. But I knew exactly what I was saying, because the point is that with great power comes great responsibility. I heard that once in a great Spider-Man movie. And Republicans are in charge. They're not 60 votes in charge, but they've got a majority of the way there. And when you are in charge and you don't have all the votes that you need, it is incumbent upon you to make a deal with the people whose votes you need. And based on prior voting for CRs, you know that there are moderate Democrats who would certainly be willing to have a conversation with you if you would do that properly timed, not open up the government and then make the same promises that they have for months. I mean, this has been going on since the big, beautiful bill was signed, that they've been saying, yeah, we want to do something on ACA premiums. And then they keep kicking the can down the road.
It's tiring gutting healthcare for millions of Americans while the man that you serve unapologetically redecorates a house that he doesn't own to the tune of multi-millions. As the federal government remains shut down for weeks at this point, Speaker Mike Johnson said that he continues to have people coming up to him and saying, quote, you look so tired on TV, which he said, I am so tired because we're not sleeping a lot. We are working overtime. Yes, this is from the same House Speaker whose chamber hasn't held a single vote in over a month, while programs that deliver healthcare and nutrition support to Americans hang in the balance. And of course, this went viral on social media and became the topic of conversation during a Fox News panel, in which liberal voice of sanity Jessica Tarlov opted to weigh in, much to the dismay of her co-hosts. And you can often tell when they're not thrilled because of how quiet the studio gets, rarely, when the truth is aired.
The reality is that this has been a stalemate for 30 days. And it's not just Democrats. You also have one of the most conservative Republican senators, Josh Hawley, who says, at least please move money around to feed people. Why not consider that?
When even the most conservative senators in your own party are saying, hey, can we at least feed people? And the answer is still no because of political strategy. You've lost the plot completely. Real people are losing access to healthcare and nutrition programs. Right now, not in theory, not hypothetically, but today. And the justification is, well, we need to keep pressure on the other side. Pressure for what? You're using people's well-being as a bargaining chip and calling it leadership. This is why the healthcare debate matters beyond left versus right. Because at the end of the day, it's not about politics. It's about whether a country takes care of its people or doesn't. And right now, a whole lot of people are finding out the hard way which one America chose.
Because if you deviate from the goal of reopening the entire government, Chuck Schumer and the radicals over there will continue to play games with people's paychecks, their livelihoods. And if you do just part of this, it will reduce the pressure for them to do all of it, to do their basic job, and that is reopen the government. This is very real and very serious, and they can end it today. They can do it right now. All they have to do is, we just need 5 more Democrats in the Senate to help us reach the 60-vote threshold. We don't have enough Republicans to do the right thing on our own. We need them to do the right thing.
We know that Harry Enton is about to, maybe while we're speaking.
We covered a lot today, from same-day doctor visits in Denmark to million-dollar baby bills in America to the actual math that nobody wants you to see. And look, every system has flaws. No country's got it perfectly figured out. But when your citizens are choosing between groceries and medication, something needs to change. So here's my question for the comments. Have you ever avoided going to the doctor because of cost and what happened because of that decision? I genuinely want to hear your stories. Like, share, subscribe, and I'll catch you in the next one.